deeper about this and how COVID-19 in our communities is impacting us, we have Dr. Bhavna Lall. She's a clinical assistant professor at the University of Houston College of Medicine. Welcome, Dr. Lall. It's a pleasure to have you. So I want to ask you, what kind of disparities are you actually seeing where you are regarding who's seriously getting ill with COVID? Are you seeing more Black and brown people in your ICU? What are you seeing there?
So, so overall, I believe throughout the country, we are seeing disparities within for during the COVID-19 pandemic, and patients who do not have access to healthcare on a routine basis and who have increased risk of chronic diseases and who have chronic diseases are also at higher risk for severe disease. So in places like the South and the West, we continue to see high COVID cases and increased hospitalizations. And there are patients who also have not been vaccinated who some of them don't even know that they need to be vaccinated or should be vaccinated and how to even get the vaccination still, even 1 year later, which is really unfortunate. Um, and of course, racial disparities do affect the COVID-19 pandemic. That has been known since the beginning and continues as well.
All right, let's talk about vaccine access, right? Is that still an issue in certain communities, especially poorer ones and communities of color?
So yes, I actually think that we need to do more to actually get these vaccines to communities of color and places that don't have access. I continue to see patients on a routine basis that still sometimes they don't even know that they can get the vaccine. So either the messaging has not come to their communities yet, or they just don't know how to sign up still. So I do think that we need to do a better job to get access to these communities that still haven't gotten vaccinated and ensure that they actually know how to get vaccinated and bring the vaccine to them if they don't know how to get the vaccine right now.
Yeah,
It's so important given
yeah,
the cases continue to rise and hospitalizations are rising.
yes, and I apologize for interrupting you. The White House saying that every American lives within miles, excuse me, of a vaccination site, but the issue is in certain communities you have transportation deserts where folks don't have a vehicle. So how are they going to access that treatment if it isn't within close proximity? Let's talk about testing, excuse me, access in communities as well, Black and brown. How are they doing there? Is it still an issue as well?
So I think overall we have rapid tests, as you know. If you right now, if you try to go into a CVS or Walgreens or any pharmacy, it's very hard to find home rapid tests. You need to be someone who is able to get access to rapid tests and also someone who can sometimes, if you need a regular test at a PCR from a site, you need to be able to actually sign up for these tests. So no, I don't think that we're doing a great job in getting testing to the places that really need it. And again, I think this is more about bringing testing to these communities. And the same issues with access are going to happen right now. Although that we have free tests being offered by the U.S. government, we're really going to have to make sure that the people that need those tests actually get those tests. So you probably have signed up yourself for getting tests online, but not everyone has access to the internet to actually sign up for those 4 free rapid tests to deliver to their home. So there is a phone number as well that people can call, but we really need to get to those communities that need testing, free masks, and actually deliver it to them because not many people, not necessarily have in access, not everyone has access to the internet and know how to actually go onto the website and order the rapid test to get to their home. And many people are also homeless. So we really need to get these tests to them and also get the free masks that are about to be delivered to the pharmacies and community health centers by the Biden administration right now to these communities.
Yeah, Dr. Love, the issue I ran into when I tried to sign up is the fact that I live in a complex where we all have the same address. We just have a different apartment number. And unfortunately, I was unable to get those free tests because it said, hey, your address, someone has already requested tests. So I'm sure I, like so many other Americans, are now without access of obtaining those free tests. What do you recommend to folks that are in that situation?
So I think that there's been many people that have actually addressed the same issue with the website, that there are people that are living in apartment buildings. So I think they're trying to address this issue. But anyone who needs rapid testing, if there are issues, you should talk to community health centers who likely will have some of these tests. And also the same place where we're about to get masks this week and next week. You should also let them know if you need rapid tests as well, because rapid tests can be provided now from the government, at least for home rapid tests, and people should have these. And hopefully this will be fixed soon, that people who are living in apartment complexes will be able to order them directly from the website.
Yeah, the governors in both of our states, because you're in Texas, I'm in Florida, fans are the monoclonal treatment. So, how are you observing the distribution of that IV infusion treatment? How is that being handled in Texas, where you are?
So in Texas, it's unfortunately, this is the issue with monoclonal antibodies, as you mentioned. So the monoclonal antibodies that currently are working towards Omicron, so Truvimab, are in short supply nationally. And as you know, if you need monoclonal antibodies, you actually need to have a doctor write this order, or you have these federal sites that are actually giving out this monoclonal antibodies. Many populations don't necessarily know that they can get monoclonal antibodies if they're high risk within 10 days of symptoms. So there's a couple issues here. You need to have access to a doctor. You need to know that within 10 days you can take these monoclonal antibodies if you're high risk for COVID, severe COVID. And you need the same issues that have come up with COVID itself. If you have unequal access to healthcare, you likely might not also know that you can get monoclonal antibodies. So in Texas, I do see that patients of mine not necessarily not know about monoclonal antibodies if they're high risk, whereas people who are more familiar with the monoclonal antibodies in the community might be able to get them through calling their doctor and getting facilitated through a hospital health system. So it is definitely there's inequities that persist from during with access to healthcare in general, and we need to try to fix these
Yeah, and the
and make people
pandemic.
more aware that they are able to access these drugs, including Paxlovid, which is also can be given within 5 days of symptoms if you're high risk as well, which is an oral therapy. But again, both are in short supply. So the best prevention right now is really to get vaccinated and get boosted if you're eligible, which is 5 months after the Moderna or Pfizer vaccine after your second dose, or get boosted after J&J, the one dose that you have for J&J, and get the Pfizer Moderna booster 2 months after.
All right, important words coming from the professional herself, Dr. Lall. Thank you so much for stopping by BNC Live. We appreciate you. All right, and another story we're following.